Welcome to the MRI mailbag with Matt. Got a few questions on Twitter this week. At SexyBoy23 asked, what is an MRI? Magnetic resonance imaging is a well-rounded diagnostic tool in that it can be used for the assessment of both soft tissue and bone pathology. It shows musculoskeletal anatomy effectively, allowing abnormalities such as subluxations or dislocations to be identified. Axial demonstrations are also an advantage of MRIs. As opposed to other modalities, MRI doesn't require the use of ionising radiation, limiting patient exposure using a magnetic field with high radio frequency pulses applied to excite hydrogen protons in tissues. A higher concentration in water and lipids, such as bone marrow and inflamed tissue, will show a great result. As these protons relax, they emit a characteristic radio wave, which is converted to an image. Illy Feet asked, what are the indications for the use of MRI? According to Yates, the indications for the use of MRI that relate to Joan include oedema and inflammation. This is as increased water content in the tissues is easily identified. Soft tissues, such as relating to soft tissues, tendinopathies, ligament, muscle and nerve pathologies. Bone marrow pathology, as detecting and localising loose intra-articular osteocartilaginous bodies. At X-Ray for Life asked, how reliable is the use of MRI? A study by Park et al. In 2010 stated the usefulness of MRI as a diagnostic tool for perineal tendinopathy in patients with chronic lateral ankle instability. Joan has recently had a lateral ankle sprain, so these results can correlate to our patient's case. The participants had surgery for their ankle instability and MRI results were obtained post-surgery and compared to pre-operative impressions. Sensitivity for perineal tendinopathy was 83.9% and specificity of 74.5%, concluding it is a useful diagnostic for diagnosing tendinopathy. However, these results may be vague. At MRI Fanatic, is MRI suitable for the everyday patient? Prior to its use, a thorough interview of the patient will need to be conducted, as metallic objects such as cardiac pacemakers should not be subjected to the strong magnetic field. Claustrophobia may also be experienced by a patient and can contraindicate its use. The patient should be advised about the cost of the treatment, as they may not be able to afford or be willing to pay for this modality. The cost of an MRI can range from anywhere between $250 and $450. However, Southern Cross Imaging charges $285 and Radar Imaging $290. A rebate for MRI can only sometimes be gained if referred by a specialist. Is that on? At Pod4Pam, would you recommend MRI in this case? I would advise this treatment to be used following ultrasound for the assessment of soft tissue due to costs and access to rebate, as ultrasound is effective in picking up soft tissue pathologies. It can be helpful in identifying bone-related pathologies, however, may not be appropriate to diagnose osteoid process avulsion fracture.